Thank you very much. Two wonderful talks so far, and also what a wonderful resource this is for women who live with endometriosis, and not only women who live with that, but their family members as well. So I'm very honoured to have been asked by Endometriosis Queensland to come along and speak with you this evening, and just, I guess, share with you a little bit of the process that I would go through if somebody like one of you or your family members or friends were to come and see me. I felt an affinity with many of the things that you were saying. And something that came to my mind was I possibly see a good number of those avoidant people. And by that I mean those people who perhaps have gone down the medical path and not had a good experience, perhaps have gone down the medical path and had a doctor who didn't listen to them or understand them, or they couldn't have those honest conversations, or for whatever reason are getting pain or symptoms and are just avoidant of what that might mean for them. So there's an element of fear. And I've been in practice now since 2005. And the one thing that I feel very proud of myself as a practitioner is that I'm not afraid to say to people, you need to see your doctor. And there's a place for everybody. And it's a matter of knowing where it begins and ends for you as a practitioner and when somebody else might be able to help. So I would just like to reiterate that I'm an acupuncturist, I'm not a magician. I don't have a wand that fixes things. But also, over my 15 years of practice, I've seen some truly remarkable outcomes for women who have been in all sorts of dire situations. So it's so important to, I think, develop an honest relationship with the practitioner that you have chosen to work with. And I would reiterate what Karen said, that if you don't feel you have that relationship, don't be afraid to go back to your GP or whoever or get on the internet and find another acupuncturist and look for somebody who you feel good about working with. Because this is never going to be a quick fix. It's always going to be a journey. And you need to feel good that you're with somebody on that journey who's got your best interests at heart and not their ego. So to that end, I thought it might be interesting to start with just to explain a little bit about this, where acupuncturists are in Australia. So there's this big organisation, massive thing called APRA. It's the Australian Health Practitioners Regulation Agency or Authority or something. And people like Karen and I and physiotherapists and dietitians and podiatrists pay lots of money each year to be registered with that organisation. Chinese medicine practitioners entered the National Registration Scheme in 2012. Prior to that, around Australia, there was no governmental registration for Chinese medicine practitioners, with the exception of the state of Victoria, where there had been a scheme since 2000, I believe. So since 2012, we have been registered as part of that scheme. And what does that mean to you? What that means to you is that if you go and see an acupuncturist in Australia, they have to have met certain educational standards. So they can't just have hung a shingle on the street and called themselves an acupuncturist and start putting needles in you or prescribing you herbal formulas that they have no experience or training in. So there's a standard now. The other thing that's interesting is that we, unlike doctors, do not have medical specialties. So Rolly mentioned that I had gone and done a Masters of Reproductive Medicine. It's not uncommon for acupuncturists now to go and do extra study in areas. And the reason I did that was because by some, freak of nature, I just started to work with a lot of women. And these women would come to me and say, oh, well, I'm doing this IVF and I'm doing that IVF and I've got this problem with endometriosis and I've got this. And that was well and truly beyond the knowledge that I had as an acupuncturist, who, by the way, we're all 4-year trained in a degree program. So I went and did that program not to become an IVF doctor or to become a medical specialist, but just simply so that I would have that knowledge to be able to have an intelligent conversation. Because what I've discovered also over the years of practice is that people come much more armed with information now that they never used to come armed with, because they've got Dr. Google at their fingertips. So that's the first thing. So if you're choosing a practitioner, just make sure that they are actually registered as an acupuncturist. And the Chinese Medicine Board of Australia, which is the body that sits under APRA, that sets our standards, you can search any practitioner's name. And if they're not there, don't see them, because they're breaking the law and you should report them. So I did study in a part of my degree in China, but I was actually enrolled in an Australian tertiary education institution, and we were able to trade 1 semester for an internship in China, which was a truly life-changing experience for me. I started studying Chinese medicine when I was 29. I had travelled extensively. I used to be an international tour director for an American tour company. And so I had done lots of travel, and I had this wonderful opportunity to go and work in China. So the difference between China and here is that the systems are integrated. And so when you go to the hospital and you complain about pelvic pain, they will do all the investigations, and then they will decide whether or not you go to the gynecologist, or whether you go to the herbal doctor, or whether you go to the Tuina, which is like a chiropractor, or whether you go to the acupuncture practitioner. So I was very fortunate to be able to have that experience of being able to work in that system and see all sorts of interesting things. For example, the treatment of endometriosis there, often they will treat them with herbal formulas through an enema through the rectum. And that's their standard care. So we can't do that, by the way. That's not something that falls within my scope of practice. I don't do orifices and things that come out of them. That's not my thing. And I established my practice in 2005 in Red Hill, worked there for many, many years. And then just recently I've gone back over to New Farm because they sold the building on me. All right, this is up Rolly's alley. A little bit of understanding of the word. I always like this slide. So just also one other thing, as well as being a practitioner, I also teach to other practitioners professional development seminars. I'm having a little break from that this year, but each year I travel all around Australia and New Zealand, off to the United States last year, and teach workshops. So I have a lot of materials, so when Jess asked me if I would do this, it was quite simple because it was just clicking and dragging slides. But I like to always include the slide and to break down the meaning of the word endometriosis, coming from the Greek endos, within or inside, mitra, the uterus, and osis, a disease process. So it's a disease process inside the uterus, except we know that that's not always the case. So you have to have your critical thinking cap on. And it comes back exactly to what Karen was saying. I often get women who come and say that they've got this pain, but is it endometriosis pain, or is it bowel pain, or are they constipated, or when does the pain come? What's the circumstances around it? So again, knowing your place as a practitioner, where the line begins and ends, and knowing if something needs to be checked out. I don't really want to dwell too much on this because you will all know this in varying degrees. I really just wanted to mention this because I will come back to it a little bit later on. I guess the thing with endometriosis is the symptoms are many and they are varied. And you could line up 10 women and they could each tell you their story of endometriosis, and they will tell you a different experience. And they'll all be different across the spectrum. The big one that most people talk about, of course, is pain, until, of course, for some reason they might go and have a laparoscopy because perhaps they're experiencing infertility and never had any pain, and then they come out of the anaesthetic and get told that they had severe endometriosis and they had no real idea about that. So one of the beautiful things I think that has come with registration of practitioners like me, and the fact that we now do these university level degrees, is that we're taught about red flags, and we're taught to think critically, and we're taught to have that person sit in front of us, and if that person hasn't had something checked out medically, well, of course they should, because medicine is wonderful at figuring out if there are other insidious things happening that, you know, I would hate to think that I treat somebody for 5 months and it turns out they've got a great big dirty tumour sitting somewhere down inside their pelvis. So I just wanted to include that. I will come back to it a little bit later on in terms of how we would work with that. Risk factors, I always like these sorts of nerdy things. I'm good at Trivial Pursuit. I like these sorts of stats. Some of the things that I've come across over the years about women who have 5 to 7 grams of caffeine per month have an increased risk of infertility due to endometriosis and tubal disease. I thought that was interesting. Women who have endometriosis, there's a tendency to drink more alcohol, and there's some suggestion that might be to do with pain. Abnormal bowel flora, sex during menstruation, and this idea of retrograde flow. Cigarette smoking is associated with a reduced risk due to lower estrogen, environmental toxins, but my favourite one is that women who have red hair have a higher incidence of endometriosis. Some of the risk factors, so again, these are the things that from a well-trained practitioner in their normal question and answer should be alert to about menstrual characteristics. One of the things that we do very much in Chinese medicine is we ask lots of questions about the menstrual cycle. And we will often start at the bleed and then work our way through and try and establish a pattern. Chinese medicine is all about patterns. So we will ask questions about menstrual characteristics. It's interesting to know whether there's been a family connection. Exercise is, has a, you know, some women find exercise to be helpful to them, but intense exercise at menstruation may increase retrograde flow. Full-term pregnancy reduces future risk, and then you've got the contraceptive issue, which we've covered earlier. The incidence, again, we've covered also in previous discussions, thought to be somewhere around maybe 10 to 15% of women. 80% of women with endometriosis experience pelvic pain, and 50% of women with endometriosis develop the condition with 5 years of having it removed. So the point of all of that is that in a practice like mine, I see women all various stages of their journey. Either it hasn't been diagnosed, they think they might have it, they've been diagnosed, they've had treatment, it hasn't helped, or it's helped somewhat but not enough, or they've had it removed and it's come back. So there's a range of people. So let's get to the Chinese medicine bit now. Here's a couple of things. A Chinese medicine diagnosis does not replace a medical diagnosis. Think of them as two things that sit nicely side by side. So this is very important because I'll bring you back to that first slide about APRA. APRA have all these things called advertising guidelines, and they are much more than guidelines. They're actually rules, and they will hang you by the tips of your toenails if you break those rules. So if you claim as an acupuncturist or as a naturopath or as a chiropractor or as anybody to be able to treat or cure something, you need to have pretty damn good evidence behind you to substantiate that claim. Endometriosis is a medical diagnosis. It's not a Chinese medicine diagnosis. I'm going to explain the difference to you in a moment. But it's about therapeutic claims. And I'm offering this to you so that if you're out there Googling looking for somebody and you see these types of things, it's a red flag because it's a practitioner that's not thinking carefully about you and leading you down a path that might not be a good path to go down. So endometriosis is a medical diagnosis. But if a woman comes to me and says, I've got endometriosis, it's up to me to know what that is and what that might mean, because it's going to give me a framework to be able to think, right, okay, endometriosis, and then it's going to help to shape the types of questions and the way that I would approach that consultation. But it's just important to remember that the two things are separate entities, but they sit nicely side by side, and one should never replace the other. The Chinese medicine diagnosis is the end result of a line of questioning. And we're going to go through that because I thought it would be interesting for you to see how that would be approached and what we come up with. And this idea that the Chinese medicine diagnosis never ever replaces your medical diagnosis. Okay, so the idea of this Chinese medicine diagnosis is that it's unique to the practice of Chinese medicine. It relies heavily on the gathering of information around signs and symptoms. And what we do with those signs and symptoms is we look for a pattern. So I'll just press pause there for a moment. I don't want to really get too much into the history of Chinese medicine, because that's a whole other evening. But Chinese medicine has changed a lot. There are universities now which research the mechanisms behind acupuncture. Last year, there was a very large systematic review published that demonstrated the effectiveness of acupuncture in treating a wide range of conditions, one of which was pain. And we're beginning to understand a little bit better from a physiological point of view how it might be that a therapy like acupuncture might work under certain circumstances and work for certain medical conditions. So that's where we are at the moment. But the history and origins of Chinese medicine goes back 2,000 years, and at a time when they didn't have that style of clinical trial. So it was built on what they call empirical evidence. And over the course of time, these old practitioners would gather together their observations, and that became the basis of the medicine and how it works. So when you go now and you study to be a Chinese medicine practitioner, about 50% of your degree is Chinese medicine, and about 50% of it is biomedicine and chemistry and pharmacology and that side of it. So we're trained to think in two ways. But the core of the type of diagnosis that we do still falls back on asking these key questions around signs and symptoms, and when do they manifest and how do they manifest, and about severity. And that process to the Chinese medicine practitioner is called pattern differentiation. So we learn about patterns, and those patterns are based in those empirical texts. But nothing replaces the fact that we're dealing with somebody who lives in the 21st century as well. And then once we build those patterns of symptoms, and they all have names, and I'm not going to share them with you because they won't mean anything to you, but they all have names. The name of that pattern then forms the diagnosis. So that's the Chinese medicine diagnosis. And we associate that to the last point, which was what we call the main complaint. And there's a whole series of main complaints. Those main complaints historically were, of course, in Chinese. So when we learn them in two languages. We learn them in English, and we learn them in pinyin, P-I-N-Y-I-N. And pinyin is the anglicised form of Chinese. So it's how Western people like us can say Chinese words and have it sound sort of maybe remotely like it sounds Chinese, but it doesn't really, because when you say it to a Chinese person, they go, huh? And you say it again, they go, huh? And you never quite get the tone right. So the main complaints, which I'll talk about in a moment, are here, caused by pattern. And that's the way we form a Chinese medicine diagnosis. So I'll give you an example. Tongbing is painful menstruation. In English, we know that as dysmenorrhea. So the pattern of the main complaint might be dysmenorrhea due to, and then there's the pattern that goes behind it. And it's the pattern that goes behind it that we then construct a treatment around. So we have to get to that point first. And so if somebody who was living with something like endometriosis were to come and see somebody like me, there would be a process of questioning, just like it would be if you go to a doctor or a physio or whoever else. There'll be questions about pain, and in particular the timing of the pain. Does it occur before, during, after menstruation? or is there pain outside of menstruation, so say in the mid-cycle? We like to know about the pattern of the location of the pain. Is it always in the same spot? Does it change? Does it radiate? Does it go down inside the thighs? Does it coincide with headaches? And we like to know about the quality of the pain. Quality of pain is very important to an acupuncturist because it helps us to differentiate that pain into one of those patterns. So whether it's fixed and stabbing, like that sort of colicky type pain, or whether it's dull and diffuse. So all those things mean different things. We'll ask about the blood. So when the blood does come, we want to know about the colour of it. Is it fresh, or does it look old? Is it pale? Is it brown? Does it look like plum jam? And is it very dark? We want to know about the quality of it. So is it thick? Or is it thin and watery? Are there clots? Are there no clots? How big are the clots? When do the clots come? We want to know about the volume of blood. Is it heavy throughout? Does it start heavy? Does it build to heavy? Is it reasonably light? Is it mostly clots? We also step beyond the bleed because from that holistic model that Rolly spoke about at the outset, we treat, we see that as your main complaint, but we want to know what else is happening across the cycle. And this becomes a little more useful and important to us if the person's also trying to conceive. But we want to know about the timing and the length of the cycle, whether it's regular or whether it's irregular. Do the cycles come short? So are they bleeding at, you're bleeding at 19 or 21 days, or are they coming long? Are they really long cycles that go on for 6 or 7 weeks? And we always ask that question, do you know whether you ovulate? To help us figure out when a period should come as opposed to when it is coming based on that point in the cycle. We'll ask questions around other menstrual cycle markers like pre-ovulatory signs and symptoms, so whether there's fertile mucus, whether there are changes in the premenstruum, so do the bowels change, is there mastalgia or breast pain, or are there emotional changes? So we're building this picture of this person who's sitting in front of us, and all the while that's helping us to construct this pattern that's unique to that individual. We then step right away from that and we then look at the whole body. What's going on in that person's life? Their marital problems, their family problems, have there been deaths in the family, all of those psycho-emotional things that we know always affect health. We ask questions around the gut, so the bowels, and we ask questions about one's appetite and your diet, and whether there's a history of respiratory problems or whether you experience shortness of breath. So there's a whole range of other questions that sit outside that menstrual paradigm that we also ask questions about. So we're building this whole body kind of context. So bring all of that back then to this idea of the Chinese medicine diagnosis. We establish that pattern of signs and symptoms by asking the questions we need to ask to get that information. We make that pattern unique to the individual, such that if you had 10 people, there could be 10 different diagnoses, but they've all got endometriosis. But it's reflective of that person's individual circumstance. And we identify what those main complaints are. So, commonly, perhaps, for something like endometriosis, there'll be dysmenorrhea, and maybe something like menorrhagia, which is heavy menstrual loss. And the concept in Chinese medicine is that we establish a root and a branch. So the symptom, or the main complaint, is the branch. So it grows out of a tree that has a root. And the root is the Chinese medicine diagnosis. So the treatment marries up the root and the branch. So we treat the symptoms and then we treat this other pattern. So for somebody like me, if you were to see somebody like me, naturally, being an acupuncturist, I do acupuncture. Each part of the Chinese medicine treatment model sort of sits under an umbrella, which we largely call Chinese medicine, but they play different roles. They all do much of the same thing, but aspects of it do some things better than others. So for acupuncture, we know that acupuncture is very good with pain. We know that acupuncture is good with spasm. We know that acupuncture has a regulatory effect on the body. The herbal medicine side of it does different things. It works more at a fluid level because it's something that you ingest, so where acupuncture has that more regulatory effect. So we tend to use herbal medicines more for internal dynamics. A word on herbal medicine, there's always some concern around herbal medicines, and just some general brief guidelines for you. First of all, make sure that you're seeing somebody who's registered as a herbalist. So I am. Not everyone is. So that's the first thing, to make sure that they've got the education to support their practice. The second thing is to ensure that the person is using a processed herbal medicine rather than unprocessed, because unprocessed herbal medicines, whilst they should theoretically be tested, they can't be for things like heavy metals and toxicity, where processed herbs are. So a processed herb is where they actually take the liquid, when you boil those herbs, they take them and then they reconstitute them in an excipient, which is like cornstarch or potato starch, and then you add water to it and it reconstitutes into a liquid. But they're tested. So and the third thing is, don't under any circumstances order anything off the internet, because you don't know its source. And if it's coming from a country that doesn't have the same high standards that Australia does, you could end up in a lot of trouble, most commonly kidney failure. And then part of Chinese medicine is also dietary advice. So helping you to choose a diet that helps support your overall health and well-being. A couple of little things before we finish, and I'll give you the little take-home. The first thing to understand is that Chinese medicine is an incremental therapy. If you woke up this morning and hurt your back, for example, and you went and saw an acupuncturist and left, you would probably find that you would have a pretty good response pretty quickly, because it's really good at settling down that acute type of pain. But when you deal with chronic conditions, it takes much longer. And it builds. So we look for change each time. So when I say it's incremental, that's what that means. If the person who's coming to see us who has endometriosis is also trying to conceive, then we work with that as well. And while we're also always addressing that underlying pattern, if a person comes and says, I've got really bad pelvic pain right now, but it's been pretty good, but it's just come back today, we always address that at the time as well. So your take home is a little bit of acupressure. This is something that you can simply just do if you're sitting at your desk or at home and you feel like you want to try and manage something, but you haven't had time to take some meds, or you've taken the meds and they haven't quite kicked in yet. Many of you would be familiar with this here. We often hear about that in terms of headache, but it's actually a point that you can use for general pain in the body. It's really easy to find. You just get the line on that thumb and you put it up against the web of that finger, roll your thumb in and just poke around until you get the sweet spot. There's a real little tender spot in there, and it's kind of like a nice pain. A bit like a hangover after a good bottle of wine. just in there. The second one is a point that if someone came into my clinic and they said, I've got really bad pain right now, and it's on the leg, and I'm going to do you all the honour of seeing my very white, hairy leg. Otherwise, it's going to be one of your very white, hairy legs, and it's the lesser of two evils, maybe. But if we were to pull that up, like so, and there's that big bone that runs along the front, and it comes up just at the top here, just in there. If you get that bit of your hand from knuckle to knuckle and put that across there and where the bottom knuckle sits, and you find the bone and just massage it, there's a really nice little tender spot on the edge of the bone as well. So those two little points might be able to... That one's probably a bit harder at work, but you've at least got the one in your thumb to think about. So that brings to a conclusion what I wanted to share with you this evening. I guess want to reiterate those safety issues that I brought to your attention about making sure that you've got the practitioner that you're seeing is actually qualified. I've had experiences with women who've come to see me who've said that they've been to see musculoskeletal therapists who practice dry needling. And dry needling is a musculoskeletal therapy which acupuncturists do, but it's a very specific technique for, say, a sore muscle. And they've told me that while they've been having their dry needling on their sore shoulder, they've also said they can help them with their endometriosis, which is way out of their scope of practice. So making sure that you find yourself a suitably qualified and registered practitioner, a practitioner who you can have that relationship with. And if your practitioner is hostile to you integrating your care across a number of health professionals, don't go and see them. Find one that will. And don't trust Dr. Google because it doesn't know very much at all. Ask questions of people who spent their life trying to learn a little bit about it. So thank you for your time. I wish you all well in your journeys. And this is a really great organisation, so I'm very thrilled to be here. So thank you.